Well, thanks so much for coming. I'm Maura Quinlan. I am an OBGYN general practitioner in Chicago and really appreciate you taking the time to talk about breast cancer screening.
Thank you for having me. My name is Dr. Christopher Smyre. I'm a family medicine physician at Southern Illinois University School of Medicine, where I get the opportunity to practice women's health, prenatal care, as well as taking care of kids and adults, and so whole continuity of life.
Perfect. So these questions come up in your practice all the time,
They
probably.
do.
Yeah.
They do.
Well, let's start while we're talking about breast cancer screening. I know when I talk to patients, it seems like the guidelines keep changing. You know, it can be unclear exactly what a low risk woman should get. Can you talk about the new breast cancer screening guidelines?
Sure. So I think it's important to help clarify that while most people who are in medicine think there's a single way and the right way to do everything, oftentimes as a practitioner, you know there's multiple ways that we can go about stuff, and we often have multiple different guidelines. And so some of the confusion people have is based on what guidelines they were looking at. And so the United States Preventative Task Force looks at data, has a committee that reviews, and sort of then makes recommendations based off of the evidence. And oftentimes when it comes to insurance and what's covered, that is sort of the guidelines that a lot of the insurances are utilizing to say, yes, we will pay for this, or no, we're not going to pay for this, we're going to need more paperwork to be submitted, and that sort of thing. And so regarding these guidelines for breast cancer screening, it used to be that if you were in your 40s to 49, that it was a shared decision where you would talk with your primary care doctor, you would decide, do I need to start? Am I at higher risk? Do I have more anxiety or worries about it? And then you would sort of make a collective decision. And then once you turn 50, that's when you start screening. And it would be sort of every other year that you're required to get a mammogram done. What we found is that when they reviewed more recent data, is that we've seen a 2% increase of women actually getting diagnosed with breast cancer earlier. And often what we find for Black women is that they get diagnosed younger and more aggressive. And so in attempts to try to preserve life and catch things when they were sort of easier to contain and treat and address, the guidelines have shifted. So now any woman who is 40 years old up to 74, we recommend getting a mammogram every other year.
Every other year. Okay. Gotcha. So more of a strict, all women, that recommendation now.
Yeah, so every 2 years you get it done.
How do you answer the question when women ask what their options are for screening? MRI, mammogram, ultrasound? What's the role for those in breast cancer diagnosis?
Yeah, so the best way to think about it is sort of think about like we have chest x-rays that we can do, we have CTs that we can do of the chest, we also have MRIs that we can do of the chest, and ultrasounds. Mm-hmm. And so the different modalities have different strengths and weaknesses. And a mammogram is basically an x-ray of the breast tissue, and that sort of is our standard first line pass of being able to see if we find or see anything that looks suspicious or sort of atypical. If we have women who have maybe more dense breast tissue, sometimes it's hard to get a clean picture to really distinguish whether everything looks healthy and appropriate or if there's any abnormalities. And in those cases, an ultrasound can be a lot more helpful for sort of distinguishing and getting a better idea of whether there's any concerns within the breast tissue. The MRI, which is a lot more detail and specificity, we usually reserve that for women that are at higher risk because we don't want to see something and sort of overcall so that we create anxiety unnecessarily or have to do biopsies and sort of follow up on things. And so that MRI is usually reserved for women who are at a higher risk because of the degree of detail that it's picking up.
So let's go back to dense breast. How would you counsel your patient who gets her report and it says, you know, normal, no abnormalities seen, but it's noted on the report that she has dense breasts? What should you do with that information?
Yeah, so usually with that information, there isn't a lot that we worry about being done differently. We do know ultrasounds can be helpful, and oftentimes, at least when I place orders, it'll have an automatics or referral order in that if it is seen as more dense breast tissue, that they can go ahead and do the ultrasound real time with the radiologist, so that when we get that final report, we have a clear and confident answer if there's any concern or if there's no concern and things like that.
What resources, especially as we're talking about someone with dense breasts who gets a mammogram and then needs an ultrasound perhaps for follow-up, for improving the diagnosis, what advice or opportunities can you offer for people who are underinsured or uninsured who think like, I just can't afford this screening?
I think one of the great things about this country is that we don't want people to have to worry about the finances keeping them from being healthy. And so I actually work at a federally qualified health center, and those are clinics and programs that are made as the safety net for being able to treat people who are underinsured or without insurance. And so there are those types of clinics that you can find where they have different payment structures and sort of government assistance to minimize the cost directly for the patient. But then also in the state of Illinois, there's a great program that any woman can call. The number is 888-522-1282. And if you call that number, they'll be able to sort of take in some information to see if you qualify for the program. But that would allow you to get your breast cancer screening test done, as well as like cervical cancer and other types of screens. It also helps with anyone who does have a diagnosis of breast cancer and ensure that they can get the care they need without getting a high bill or a high cost associated with that.
Great to know that there's resources for people, because it would obviously be expensive. Have you had any patients who say, I don't want to do it because I've heard it's painful? How do you answer that question?
Yeah, I think you have to be honest. It is some discomfort with it. And I have to be honest, I'm not speaking from personal experience. But I think it's important for people to understand that the degree of discomfort that comes from sort of evaluating can offset a lifetime of discomfort, because the whole point of screening is to find something, if there's something to be found while it's still small, so that they can do a more simpler procedure to remove the concerning area or sort of start early interventions to treat it, so that we're able to cure and give you your full quality of life versus limiting that because of the complications that can come from that cancer growing.
That's a good balance. A little bit of pain now, save more pain later. Are there any misconceptions to breast cancer screening that you feel like you have to correct when you're talking to your patients who are perhaps new to screening?
Yeah, I think there's a lot of beliefs that people have from things they may have seen or information they may have misunderstood or misread. And so it's always important to be able to talk to your primary care doctor with any question you have, just so that you really do have all the facts and you're making a truly informed decision that's in alignment with your values. Oftentimes, one of the concerns that people have is sort of, I would know if I had cancer. I'm going to feel something different in my body. And unfortunately, oftentimes you don't until it's really overgrown to really burden the body. Our bodies are very resilient. And so when things are small, our body's able to sort of compensate and you may not even notice it. And that's really the whole point of this, is to catch things while they're still early and simple before they get bigger. I think another misconception people have is sort of, I check my breasts every day, and so I know nothing feels different. And while that can be helpful if it's of a certain size, for very small ones that could be a very simple procedure just to remove that abnormality, your fingertips aren't going to be as refined enough to really sort of have the degree of detail of detecting it. And so oftentimes it really is wanting people to not have a false sense of security when we can have true security with knowing exactly the health of your breast tissue.
Yeah, that's good advice. You can't always know until it might be too late. Do you have any kind of go-to reassurance? How would you tell people who are just afraid?
I think everyone processes the unknown in different ways, and everyone has their own story of maybe loved ones that they've seen suffer, or other friends and family who may have died from cancer. And I think what's important for people to know is that the screening isn't changing the reality, it's just providing you with more options so that you can truly decide how you want to live your life, what interventions you may want to do. Just because we know that someone has something doesn't mean that we have to treat it aggressively, but at least we're now at least now you are in control of deciding how aggressive you want to do. You're in control of knowing what exactly is in your body, what to expect of your body as it's sort of evolving and developing. And I think really making sure people understand that this isn't going to limit your life, but it really is going to put you in full control, because you know exactly what's going on and what you want to do now with your life with full information about your health.
Yeah, that's great. Anything else that I haven't asked or that you'd like to talk about that helps you as you talk to your patients about screening for breast cancer?
Yeah, I think it's so important for us to recognize and understand that the whole role of screening is really just to find something that's already there. The screen test isn't going to make something come out of nowhere. And once we know what's there, we can now talk about what interventions are on the table for consideration. A lot of times we think about, well, what can I do to be as healthy as I can be? We know that smoking increases your risk of cancer of all forms. We know obesity increases your risk of breast cancer. We know that if you're breastfeeding, that can reduce your risk of cancer. But those lifestyle changes don't take the place of screening and taking a look. They just sort of give us insight of whether we're anticipating something being found or we're anticipating it coming back, everything's normal.
Yeah, that's great. Great message.